As a teaching hospital, in addition to being a referral hospital, students and consultants mingle freely to allow for hands-on-the-job training for the would-be next generation of health practitioners that will either continue in this ecosystem or move on to other health centers.
It's a place where you don't have to go far to access many subspecialty training. In LASUTH, that's the College of Medicine, we believe that we are one of the fastest growing colleges in Nigeria at least, if not in the whole of West Africa, because anybody who seen the development over the last couple of years would know that there's been quite a lot of development that has taken place in LASUTH and even LASUTH. Not only do we have basic infrastructure being put in place, the environment is quite rich in terms of research, in terms of quality of training, in terms of appropriate educational materials that are being provided, and we sort of thank the state government and the management of both LASUTH and LASUTH because the environment is constantly changing, and it's becoming more and more conducive for both lecturers, students, and the other staff that are in LASUTH.
For ease of service execution, there are components which are divided into the clinical departments comprising the anesthesia, community health and primary health care, dietetics, dentistry, ear, nose and throat, medical records, medical social welfare, family medicine, hematology and blood transfusion, intensive care unit, laboratory services, medicine, NHIS, nursing, gynecology, ophthalmology, pediatrics, pharmacy, physiotherapy, psychiatry, radiology, and surgery. And for the non-clinical departments, it comprises of the accounting department, administrative, audit, catering, domestic, engineering, information and communication technology, laundry services, legal, procurement, public relations, quality assurance, security, store, tailoring, and transport. Besides the equipment and instruments for work, these individuals are in constant interface to make up the whole, helping to deliver on the policy mandate which stipulates a free treatment of health cases within the first 24 hours, whether for first-timers, emergency cases, or even on referral. The custodians, whether at the subspecialty level or administrative, say the impact of healthcare delivery to the society, immediate and remote, can only be measured from the number of daily callers and the cutting-edge breakthrough healthcare delivery which cuts across the rich and the poor.
There are three categories of patients. The patient comes in here, he's on the NHIS, the National Insurance Scheme. He's seen at the Family Health, Department of Family Health, and he gets his service smooth through because companies pay for the insurance. Then there's another set of patients who would come in and they would see the doctor. They will have their cards free. They will see the doctor. The diagnosis will be made. Drugs will be prescribed, but they fall under the free health. Those ones come to my office and they get most of their drugs, free health. Fortunately, we have two pharmacy groups running within the hospital, okay, because the government envisaged this might happen. We have the hospital fee-paying pharmacy, which we call the joint venture pharmacy, which is a consortium of about 4 or 5 pharmacists here to provide all the drugs we need, okay? And there's the non-paying pharmacy, which is the hospital pharmacy, which we provide basic drugs that will address basic issues. So if you come in here, it may be slow if you belong to the second group because you have to push paper, you have to push the pen, things have to be. But if you come into the NHIS, it's smooth.
We actually provide quite a wide range of services that we have for anybody with renal disease. We have a general medicine clinic where we see both kidney disease related and general medicine cases. And then we have a subspecialty clinic in which we see predominantly renal patients, kidney disease patients. And we see both the early forms, the late forms of kidney disease, and also patients who have various other types of kidney-related issues, severely hypertensive patients, diabetic patients who have some kidney involvement, and so many referrals from other clinics. We run a dialysis unit, which we take care of patients with very severe and advanced form of kidney failure. And we also do both the infected cases, HIV cases, hepatitis B, hepatitis C cases, and then the non-infected cases, which we handle.
Like every such good gift, the facility here gets pretty much overstretched regularly, and it continues to be an area of review for management.
There's still room for, more training. But I think for Nigeria, yes, we are, there, but worldwide we still have to improve on whatever we're doing and to, have more training in other fields of ophthalmology, that had not been looked into.
Only recently, the governor of the state, Mr. King Umiambode, commissioned a helipad, paving way for airlifting or landing of patients for prompt medical attention.
With what Lagos State government has planned for this teaching hospital, very soon, I don't think there will be any teaching hospital in the country that will be able to compare to this place. We're almost there. We're not there yet, but there's a commitment, the political will to get things done, the commitment to see it happen is in the government, excuse me, and the resources to be able to do it is also there. Yes, resources are scarce and everything, but when you have a government that is determined, they will always find a way to get things done, and that's where we're going.
All of this does not, however, exclude LASUTH from several shortfalls and challenges. There is the job to be done to correct the apathy of society members who are convinced that once it's a general hospital or government-owned, then it's only at the mercy of those who still patronize such locations.
If we start moving to India, we start moving to Pakistan, we start moving to all these countries, we are depriving our own doctors, specialists, of acquiring the experience that would lead to improvement in our health system. And if you travel to those countries and then you are coming back to meet the same doctors, what you've done is to deprive the doctors that exposure. Over time, the system matures. You build experience, you build competence. And if we keep on doing this to ourselves, the Indians get the experience, they build their system, you're going there to pay money, and at the end of the day, you might be spending much more than you would have spent in Nigeria.
Is LASUTH a world-class health community? Well, maybe the journey is on the way, especially considering the research work, training facility, equipment, personnel qualification, number of referrals, and the policy drive of becoming really world-class in a compassionate environment. That will be a concluding part of today's show. Watch out this space as we'll be bringing to you yet another celebrated medical breakthrough, and that's talking about the cochlear implant procedure. Thank you for your time. Join us again next week. Bye for now.